Cool. Okay, so it is now the 1st of October, 2021. I am starting with Mastering Healthcare Terminology, 6th edition. I'm going through right now the slides. So this is the active or the lecture portion of the class, the live lecture. I was having some problems with Zoom technology over the past couple of days. Looks like I might have fixed that. In fact, this blurry stuff behind me, I'm not sure how that happened, but I'll take it. That's pretty cool. We have had the first week so far has gone pretty good. There's a few of you I haven't heard from so far, but I'm going to be contacting you in the next 24 hours, and we have to send in kind of like a login request for people to make sure that we're all getting on the same page. So my phone is still active today, so we might have that to deal with. I'm going to try to slow that down a little bit right there. And we'll go from there. So I'm going to go ahead and start just doing the lecture portion of it. I'm not really worried about people participating at this point, but it will be on YouTube because I'm going to save and download this. And we're also going to download to the Zoom recording. So this again is for the Fortis online college course of medical terminology, and we're doing which is OAHP 105.06. Sounds like a radio station, doesn't it? And it is the September term. Now I'm going through Mastering Healthcare Terminology 6th edition by Betsy Shiland, and we're going to be starting to go through. I'm going to go through all the slides of this one. This is 51 slides. It's pretty fast. Chapter 1, chapter 2, kind of things like that. Now, the most healthcare terms, and I'm just going to keep going through. We're on page 2. I'll just tell you which page we're going through, and I'll just kind of talk about each of the pages. You can follow along on your own computer and just like make this really small down in the corner or something like that. So it'll be just like you're following. So that'll be easy peasy, I think. We'll see if we can do this in about 30 minutes. Anyway, the most healthcare terms are of 3 or maybe 4 kind of flavors. There are Latin terms, there's about 40%, and another 40% is Greek. And the other 18% are words that are usually people's names or some kind of thing like that. And the rest of them are just words that are stand by themselves. They're really not from any language. They just kind of hang by themselves. We'll have examples of those as we go along. Okay, here this is lesson 1. This is a decodable term, so it's terms that you can decode. The whole idea of a terminology is to decode the words. Now, one of the easiest ones is like sternocleidomastoid. It's a muscle, so it'd be technically a sternocleidomastoidus muscularis, which is a muscle that goes from the sternum here, okay, clavicle here, and then it goes up to the mastoid. So it tells you a lot about this muscle. It goes from the sternum, from the clavicle, to the mastoid. The mastoid processes back here, and that word tells you its origin, where the beginning of the muscle is, and its insertion, where the end of the muscle is. Okay, so we talked about. We'll talk about more about those. We're on slide 4 right now. Non-decodable terms, about 90% of healthcare terms can be built from other parts, but 10% can't. So cataract, asthma, etc., that kind of stuff. So as we talk more about vocabulary, it's not just peeling apart the words, but understanding what they mean. So there's a couple words that we go through here. This is slide number 6 real quick. We're talking about prognosis, which is prognosis is what it's going to do. Now there's a different one called sequelae. And sequelae is what's going to happen after. And now we have the diagnosis is to split it into conditions. So we know what the condition is, diagnosis, which we know we're setting apart our knowledge of it is what it means. Gnosis means to know, and die means to, or to split. So we split our knowing of it. We split apart our knowing of it is what it really means. So diagnosis is giving you what the present condition is. Now, when we're doing diagnosis, we also have something called differential diagnosis. Differential diagnosis is where we come up with other diagnoses that are possible. So if someone comes in with head pain and they say, I have head pain, well, our diagnosis would be like cephalgia, ceph meaning head, algia meaning pain. However, our differential diagnosis could be things like trauma, tumors, other pain syndromes. We've got cancer, We've got eczema. I mean, there's a whole bunch of things that we want to rule out. So we want to be able to rule out different issues in the realm of like severity. So you want to go with the worst of the worst of the worst first is differential. And then you go less, 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 less. And hopefully the one that you guessed it is the correct one. So let's say it's just like a simple tension headache or something like that, or migraine. Now we also talk about the timing of these things. So it'd be good. We'll go over later. I'm going to do a different video where we'll go over like SOAP notes, SOAP, which is subjective, objective assessment and plan, or we'll go over like LOPQ or ST, which is kind of a diagnosis or an evaluation kind of thing. We'll also go over some of the other stuff too. So we have like acute, subacute, and chronic. Acute is happening short term. Could be like sharp pain, like acute headache or acute sprain is something that's happened within the past day or three, let's say 3-5 days. Subacute is after that. So after the swelling is starting to go down, it's subacute. And after about a week, it becomes chronic. So if you have pain that's chronic, it's been over a week or over 2 weeks, depends. Now, other things too, we have to think about with that is it mild or slight or moderate or severe? Now, those are medical legal terms. Medical legal terms are ones that you will use probably if you're writing reports. So one of the main things we would do, like, is it occasional or frequent or constant, right? There's occasional, frequent, constant, intermittent are all like legal terms. Now, in the evaluation of pain, we can have what's called the VAPS, is the visual analog pain scale. And that's usually the one that I'll show you with the pictures of like either a scale from 0 to 10, 0 being no pain and 10 being like, the worst pain ever, you can't even breathe. Kind of, you can't even sleep. And then there's other ones too, where we would have like little pictures of smiley faces or sad faces or angry faces or what have you. Now, those are different ones there. So acute versus time and severity of disease. Okay, complaints. Now, this we get into here, this is going to be this, what do we call SOAP notes? SOAP notes are the regular notes that healthcare provider uses to document a patient encounter. So the SOAP note would start with the subjective complaints. Subjective complaints are things that you, the patient will tell you. Okay, subjective is stuff that you can't know. It's pain, it's tingling, it's numbness, it's achy. How do you measure that? You can't measure that. We just have to document it down. Now, those are also going to be the observable signs you're going to have after that, which is going to be objective. Okay, these are the signs and symptoms. Signs are like subjective signs, which are like, we would have things like my head hurts, I'm itchy. Now, with itchy, the objective part of that would be you could see something on the skin, the redness of the skin where they had scratched, or you see some like lesion, something. You see an area of the skin that is discolored. That is an objective finding. Objective findings are things that they can tell you still about it, but it's easier to see from the outside. Subjective, from the inside, they have to express it to you. My stomach hurts is subjective. Objective is bloating or borborygmus, which means grumbling of the stomach. Drink my nice hot water today. You guys should drink water too, right? Now, symptoms are patient's explanation of what's going on. They tell you their symptoms. Signs are what you see, right? A sign is also blood pressure, temperature, weight, height, let's see, blood pressure, pulse rate, respiratory rate, those kind of things, temperature, that kind of stuff. Eponyms, okay, these are just different names for things. Achilles tendon. So Achilles was an ancient Greek story. I believe it's Greek or maybe Roman. But anyway, Achilles had a tendon, or we all have a tendon, but that's how his mother held on to this Greek god and dunked him in this basically a pond, which made him like invincible, except for his Achilles tendon, because she had to hold him by something, otherwise she'd lose him down in the water, right? And so later on, the reason he's defeated is because some guy shoots an arrow and hits him in the Achilles tendon, and he falls down, and that's it. They're done. Okay. Now, abbreviations and symptoms. This is slide number 10. So abbreviations. And symbols. So we do have some symbols that we use. You know, there's the typical male symbol, which is like a circle with an arrow sticking up, which is also for I believe Mars, right? And then for Venus, it's the circle with the little cross that goes down, which that's supposed to exemplify the uterus. Okay, because the uterus and the fallopian tube is kind of an idea. That's for Venus also. So these go back to Greek kind of things. Those are the Greek symbols. Now abbreviations would be like ADD, ADHD, AIDS, which is acquired immune deficiency syndrome. Other ones would be like ALS, amyotrophic lateral sclerosis, or AS, which is ankylosing spondylitis. There's a dozens and dozens, or CPR, which is cardiopulmonary resuscitation. And then of course you have symbols like up symbol, or a triangle means change. Okay, these are chemistry symbols. We use them in chemistry and all other sciences as well. Dangerous abbreviations. QID. Dangerous abbreviations, what they're saying is, so a funny story about this one. So a dangerous abbreviation is one that you don't usually want to use because you don't know, it's not common enough, or people don't understand it. Sometimes it's better just to spell them out. When I was a medic in Los Angeles, we had a man who had breathing problems, and he was also pretty combative. And because he had breathing problems, he was panicking, right? So we were treating him. And in the report, we wrote a 35-year-old, or whatever, I can't remember how it was, a 35-year-old male, 35Y.0-year-old male, with a little symbol, SOB. So SOB means shortness of breath, but people thought it meant something else. So we got in trouble for that. So those are the kind of the dangerous ones we have to watch out for. Check, assign, reverse, and define method, card method. Oh, so here we have, this is on slide number 11. This is actually a really good one. We talk about decoding words. So when you have like glossitis, glosso means tongue. Like think of tongue as being glossy, and itis is inflammation. Now, osis is condition of, itis means inflammation. It doesn't mean infection. It just means inflammation of, okay? And inflammation has some different parts, and we could go over those. I think I go over those in one of the other videos. You can watch other videos on YouTube. The best place to see them. So I go through each of the weeks, remember, on those. This is week 1. We're on what, slide number 12 right now. So check, assign, reverse, and define. Blah, blah, blah. So check, assign, reverse, and define is the card method. Okay, check word parts in a term. See if you can figure out which word parts there are. So you have like atropic carditis as an inflammation. It's an example. Okay, atropic. A means without. Tropic means development. So without development. Cardio, card means heart, and itis means inflammation. So it's a decrease. It doesn't make much sense, but it's an exercise in the word. So you can look through different words, start picking them apart. And the idea is to find the little pieces of those words as you go. Now, check word parts in a term, assign meanings to the word parts. You're not assigning the meanings to the part. You're deciphering the meanings, because you can assign any meaning you want, right? But we're assigning the meaning that it actually is. Reverse the suffix in front of the term and define the term. Okay, check words with glossitis, tongue inflammation. Okay, there we go. Inflammation of the tongue. Now the reversing is just putting it in common English. Okay, so this is glossitis. Gloss, for this example on slide 15, gloss meaning tongue, itis means the inflammation. We don't say tongue inflammation, we say inflammation of the tongue. That's why we basically say that. Decoding and define the term, inflammation. Sorry. Okay, easy. New word parts, so combining forms. So we have, remember, there's prefixes in the front of the word. So that's going to be like, a prefix is like a, or at, or pre, or something like that, or post, something like that. So those are the prefixes, pre, before, and then suffixes at the end, and then the combining form in the middle. So here we have combining form arthro, gastro, ophthalmo, auto, and rhino. Okay, so arthro, whenever you see Arthur, think of Arthur, he doesn't move very well because he has arthritis. That's arthritis. Arthro means joint basically is what it means. So arthritis means inflammation of the joints. Different kinds of arthritis or arthritides, we would say in those. You can have rheumatoid arthritis, which is an autoimmune, which means your body is attacking itself because it freaks out and doesn't recognize you anymore and kind of goes after you. Or you can have degenerative. So say you've been using your hands for years and years and years, and your knuckles are getting worn out. Okay, that'd be degenerative arthritis. Now you can say arthrosis, which is a condition of those. That's also acceptable, but typically people use arthritis for everything. Now you can also say pain in the joints, which would be arthralgia. Okay, you could say arthrotomy. Or you could say arthrotomy is to look into or cut a joint. You could say arthroscope, to look in a joint. Yeah, you could say arthroscope. Orthoscopy, we say orthoscopy, but we say arthroscopy. You can say that absolutely for like a knee scoping. Arthrology would be the study of. Ology means to discuss or to study, and then plasty means to rebuild, I think. So you can also see gastralgia, so stomach pain. Gastro means stomach. So gastro, like think of, so it's funny, gastro means belly, and there's a few weird things about it. So we have the gastrocnemius, which is the calf muscle, which is right here, but you can't even see that on here, but whatever. The calf muscle in the back is called gastro. Dang it, I just forgot the total word. See, it's like I connect them and then it disappears. The gastrocnemius, that's the name of the calf muscle in the back because it looks like a little belly, if you look like a belly, right? And think of like gastrophetes, which is a kind of crossbow that you had to hold against your belly to shoot. So it's a weird example, but that's the only example I think of. So gastro means stomach. And like you get gas, right? That makes sense, right? So gastralgia means gas. Gas pain, stomach pain, right? Gastrotomy, to cut the stomach. Gastroscope, gastroscopy. You could use that term, not a very common term. Gastrology, someone who studies the stomach, I guess. And gastroplasty is someone who like fixes the stomach, right? Ophthalmo means eye usually. Now you can use opt also can mean eye, but ophthalmo means the eyes. Okay, ophthalmologist, for example. We don't say arthrologists. We say, like for joints, we don't say an arthrologist. We don't go to an arthrologist really, but we go to a rheumatologist. Now rheumatology, RHEUM, means like fluid. It means like really like slimy fluid. That's what rheumo means. And so that's a weird word, but someone who studies the fluids in the joints really, I guess is what it is. Ophthalmalgia, you can have eye pain from like sun exposure or something like that. Ophthalmotomy, I guess, to cut the eye. Ophthalmoscope, we have those. Those are the things you look in like this, and see the eye. Then you look at the retina, which is the back part of the eye. You can look at the vessels inside there. You can look at the cornea, which is the surface, or the lens, or the iris, which is the colored part. So those are things. Ophthalmology, ding, ding, ding. There we go. Someone who studies the eyes. And ophthalmoplasty. I'm not sure if that's a word that works really well. Some of them are just awkward. We don't use them, so we find more snazzy words to use. Auto means ear. Okay, so OTO, auto. So autalgia means ear pain. Autonomy, that makes sense. You could say autonomy would be to cut the ear, I suppose. Otoscope is the ear thing, which is a little, has a little like a funnel that you can stick in the ear and look inside the ear and see what's going on there. Look at the tympanic membrane, tympany, like the drum, the eardrum. You can look at the otology. We don't really say that, although you might hear it sometimes. And then otoplasty is someone who has an ear reconstruction, like someone who gets a cauliflower ear, which is from boxing or wrestling. This would get all like puffy and it stays that way. Rhino means nose, so it's an easy one because think of rhinoceros, right? It has a big thing like this, and we have one too. There you go, your nose. Or rhino, so rhinologia would be nose pain. You punch in the nose, you get rhinologia. Rhinotomy, a nose cut. Rhinoscope, I guess you have those, rhinoscope. Usually what they use is just the ophthalmoscope or the otoscope with a different connector on it. It just has a little larger funnel that you can stick up inside there, looking back and see the sinuses. Or rhinoscope, rhinology. No, we don't usually use that one. And rhinoplasty, that's a reconstruction of the nose. So you get your nose done. So like for me, you can see right here, I have this little crooked part because I had broken my nose before, and you get it refixed. That'd be a rhinoplasty because I had rhinology, and the rhinoscope showed that there was a need for a rhinoplasty. I guess. There you go. Decoding an action. So algia is a patient complaint of chronic gastralgia. Gastro, again, stomach. Algia, pain, stomach pain. Decoding, yeah, pain of the stomach. Reverse it, pain of the stomach. Okay, 20. Decoding an action, pain, and so you're just basically, you're making a few words into a sentence. That's the idea of it. And the better you explain that. Now, here's a hint, guys. When you're doing decoding of these things and you explain it, it'll help you to do that. One, it makes you sound way smarter because people don't even know what the word means. You might as well say blah, 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 and as long as you can decode it into a sentence, you all of a sudden sound so much smarter. Okay. Like I'm trying to think of a good example that I have. But a lot of people will ask about questions and you're like, well, that totally makes sense to me because you know the word, right? You already know the word. You're one of these people who've been, practicing this, or you understand the word. You've had this condition before, something like gastrology. Like gastrology, what is that? Man, that sounds terrible. Is that some kind of like, if you think of the word without the context, like gastrology, I mean, that could be, he's from Gastrology. I mean, it could be a country. It could be he drives a 1962 Gastrology. It could be a kind of car. We don't know. So if you know what it is, you say, well, let's see. If I split that word up in my head, I know that algia means pain and gastro means stomach. So this is pain of the stomach. It says some stomach discomfort is gastrology. People go, wow, how'd you know that? Because I'm smart. Whatever, I took anatomy or medical terminology. Anyway, the patient complained of chronic. So we know that's been around a little while, right? Pain of the stomach. Complain a sign or a symptom. Is it a sign or a symptom? Gastralgia, pain is always a symptom. A sign is what you can see. Okay, signs, not symptoms. Symptoms are what they tell you. That's going to be subjective, and objective is going to be like, let's say, like if you're examining a patient, and we do what's called IPPA, which is inspection with our eyes. We look at them and say, ooh, this person looks like they're in pain. So we can see, oh, they're pain, their face and all this kind of stuff, and they're rubbing their tummy. He says, well, okay, I could assume through body language, which is about 80% of our communication anyway, that they have pain, maybe in their stomach. So initially I'm thinking gastrology or some kind of stomach ache. And then they say, oh, my stomach really hurts. I've been burping a lot. It's painful. It feels like there's fire in there and it's cramping and all this kind of stuff. Okay, so that's some kind of gastrology is the basic term. Now I can do inspection. I look at them. I look at the stomach. Oh, it appears to be bloated. There doesn't appear to be any discolorations or any malformations that I can see from the outside. Now you go percussion and palpation. Palpation is using your hands. And so what you do is you'd push into the belly gently to see if there's any pain. They go, oh gosh, there's more pain down on that right side. They'll say, oh, okay, so this could be like gallbladder or liver, because we know our anatomy now. We know that the liver is on the right side, and right below it is the gallbladder, and down below that is the appendix. Now there's a different test for that, and I'll tell you about those later. So we do some palpation, and now you can do some percussion. A percussion, like a drum, percussion, right? Percussion is when you see the doctor put their fingers on you this way and they tap. Okay, so if we listen, let's see if I can show you here like this. Watch. So my liver's here. Okay, here's my rib cage, right? Here's my rib, the end of my ribs, and my liver should be right under there. And this should all be lung, right? So I go like this. It's a different sound. Bop, bop, boop, boop. Okay, that's really kind of the difference. It takes a little bit of finesse, a little bit of practice. You guys don't have to worry about that, but you can play on each other, kids and whatever. It's just and you're listening for the echo coming back. So if you get across something that's hollow, it'll be bop, bop, like a watermelon. I have a terrible time diagnosing a watermelon, whether it's good or not. So I use my everybody else in the family. They can go do it. I have to bring them along to buy a good watermelon. Otherwise I get mashed potatoes that are nasty. Building terms. Most terms are built according to 5 simple rules. Oh, 5 rules. You must know the difference between a consonant and a vowel. Consonants. Okay, consonants and vowels. So the vowels, A, E, I, O, U, and sometimes Y in English. And then the consonants are all the rest. So like B, K, C, D, F, M, R, Q, Z, or Z, right? So vowels, A, E, I, O, U. So here we go. If the suffix starts with a vowel, the last part of the word, suffix, starts with a vowel, a combining vowel is not needed. So we look at, I'm on page 24 or slide 24. And as we look at this, if the suffix, the last part of the word, so let's look at arthritis, I-T-I-S. Is there a vowel there? I, A, E, I, O, U, I, yes. So you do not need another vowel to combine them, right? If you don't need to keep the O because the suffix starts with a vowel. If the suffix starts with a consonant, so let's look at arthroplasty. So plasty, P, that's a consonant, not a vowel. Okay, so A, E, I, O, U, and sometimes Y are the vowels, and it's a consonant. So we're going to do arthro. We're going to add an O in there. Okay, we're going to add a vowel. We get to add a vowel. Okay. Can I buy a vowel for 20, whatever, I don't know. Building terms number 3, if a combining form ends with the same vowel that begins the suffix, one of the vowels is dropped. So so cardi, like Cardi B? No, it means heart. Cardi means heart, actually. So cardi, C-A-R-D-I plus itis, carditis. So we don't do cardiitis. We drop one of the vowels, we do carditis. Okay, so it's easy, just drop one vowel. You don't use 2 vowels anymore. So it's like cardiology. We wouldn't say cardiology, we say cardiology. Okay. Building number 4, if 2 or more combining forms are used in a term, the combining vowel is retained between the 2. Okay. So these are rules, but as you see them used, you'll see like, oh, okay, this makes sense. I don't even need a rule anymore. So gastro and entero. Gastro means stomach. Entero means entrails, which is like really your guts. That's your small intestine. So gastroenteritis. So it's gastroenteritis. Okay, gastro. You keep that O, and then you can drop the next one, entero, and add for the itis. Okay, easy peasy. Number 5, sometimes when 2 or more combining forms are used to make a term, a special notice needs to be paid. What? In order to which the combining forms are joined. So this one goes esophago, this is the esophagus, it goes all the way down to the stomach, the gastro, and the duodeno or duodeno. Duodenum is the first part of the small intestine. So this one plus scopy. Esophago gastroduodenoscopy. Wow. I don't think you'll ever see that word. Use endoscopy. And we're going to look at the endoscopy for the stomach and small intestine. That's basically what it'll be. It's a cool word because that's like, wow, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 18, 19, 20, 21, 22, 23, 24, 25. That's 26 letters long. That's like a huge score in Scrabble. So you'd win just because of vocabulary. It means you're going to win all of your Scrabble games for the rest of your life. So there. Okay, lesson 1, 2, this is 29, introductory word bank and plurals. Use the rules given to change singular terms in their plural forms. Much like everything else in English, they follow most of the same rules. Okay, recognize, recall the introductory word, prefixes, suffixes, and combining forms and their respective meanings. Building your word bank, noun, suffixes. Suffix, the last part of the word, right? Structure or thing. Hypo means below or deep to. Hyper means above. Dermo means skin, and is is a thing, like hypodermis. Okay, dermis is a thing. Trying to think of other things, but those are good ones right there. Dermis, skin. Hypodermis, under the skin. Okay. Structure, like a membrane. Okay, or a thing. Another kind of structure. It can also be so is or endocardium. Okay, cardium. The cardium. Cardium is a part of the heart. Okay, small would be ICLE, OLE, or ULE. So cuticle, arterial, or venule. Arterial, okay, arteries, which are vessels like tubes that push blood or hold blood pushing away from the heart. Veins go back to the heart all the time. It has nothing to do with blue and red. Venules are small ones. Venules, you could say, but we don't. We say venule. Arteriole, O-L-E, or arteriole. We don't say ULE. I don't know why. It must have something to do with the other vowels in there. But notice arteriole, I-O. It has two. So as opposed to venule, V-E-N, N is a consonant and U is a vowel. So a little bit different. So we just know that cuticle, small part of the finger, right? Building your word bank, adjectives. So adjectives and adverbs. Adjectives explain nouns, and well, they give action. Actually, is what they do. A pronoun is what explains a noun, right? And then we have nouns, which are like proper things. Okay, so like a chair is a noun, but a soft chair explains what the chair is like. Okay, etc. Okay, so that's basic English stuff. I know English is a weird language. There's a lot of things. I mean, you have no and no, K-N-O-W and N-O. There's a lot of words that are spelled the same. There's a lot of weird things that we add in there for other weird reasons that we've done. Cough, C-O-U-G-H. What the heck? Cough. Why not K-O-F? Right, that makes sense. That would be more Germanic. But anyway, so back to this. Suffixes that mean pertaining to. So we're talking about whatever the noun is. So cardiac, cardiol, al, I was gonna say valvular. Okay, this one coronary, cardiary. You don't say cardiary. Okay, we say esophageal. Okay, hypodermic, and subcutaneous. OUS. OUS is a very similar one. Okay. Building a word bank. Pathology. Algia means pain. Emia is a condition of the blood. Okay. Gastria, without stomach pain, is what that means, and tonsillitis, inflammation of. Okay. Building your word bank. Pathology. Malacia. So malacia means like decreasing or softening. Okay, there's like chondromalacia. Malaysia. You could say Malaysia is the more common pronunciation of that. Chondro means cartilage. So you could have arthromalacia. You could have osteomalacia. So those are softening of the bone. Osteomalacia. Anything osteo is bone. Chondro is cartilage. Arthro is also cartilage. Megaly means big. Okay, you can have colon-megaly, ileomegaly, whatever. This is splenomegaly. So it's the spleen, which is a little organ, which is part of the lymph system on the left side, okay, underneath the diaphragm, is a, which is the big muscle that separates the thoracic from the abdominal. Splenomegaly means the spleen is big. Okay, building your word bank. Ptosis, sclerosis, and stenosis. Stenosis means to narrow. Sclerosis means to harden. Ptosis means to actually becomes weak. Okay, like the ptosis, like this is the ptosis condition. Hysterotosis would be like hysterectomy. So we're talking about the uterus. Okay, now funny thing about that one, we talk about being hysterical. Used to be thought way back in the day, no kidding, that the uterus could somehow escape from where it was and run around the body and cause all kinds of problems. That was science, guys, back in the day, like 1600s, 1700s. Of course, those were the days if you had a cat and you were kind of a like eccentric lady, they would call you a witch and burn you with a stake. But you know, hey, whatever. Hysterectomy, same thing like lunula, which is like this part of the fingernail, which looks like a little moon. Okay, lunula, like loon, Luna means moon, and lunatic means one who's crazy about the moon, or not with the moon, really is what it means. So full moons, people going have lunacy. Okay. Atherosclerosis or arteriosclerosis. So this is arteries. Arteries become hardened, sclerotic. Okay. You can have sclerotic, any of those places, but it's very common in arterial conditions. Okay. It just has to do with cholesterol and hypertension, stuff like that. Stenosis is narrowing because you have so much stuff in there, you get sclerotic. Okay. That kind of thing, the narrow part. Building a word bank. Graphy is a exam. Metry is to measure. Opsy is to, really it means to look, okay, to cut out and look. And scopy is also look, but opsy is to take a piece to look at. Okay, so we have mammography. Mammo, we talked about mammal, the mastoid. Okay, there's also mammillary glands inside the skull. Actually, inside the brain. But the mammary as in mammal, is the breast tissue. That's the part that makes the milk. Okay, those are the glands. So we have a mammography. That's where they take the X-ray machine and they smash down the breast and they try to look and see if they find any anomalies. Spirometry. We measure the spiros. What the heck? Spiro has to do with breathing. The word spirit and the word inspire and expire all have to do with breathing. And in Greek, it would be P-N-E-U-M-A, pneuma, okay? Pneumonia, pneumocystic something, pneumoconiosis. There's all kinds of words that have to do with lungs and breathing. So pneumonia, and also spiro is spirit, okay? We are inspired, we inspire, we expire or die. Okay, that's expire. Okay, that's all the same part of the root word. That's what makes it kind of interesting, is that remember in those days, pneuma was considered kind of like the soul 2,000 years ago in Greek thinking. So your life force was part of your breath. Now we see the same thing in Hindu or in Vedic kind of ideas where they talk about prana. Pranayama is a breathing technique. Okay. Biopsy is to take a piece, and now there's two parts. So we have your part and this part. We pull the piece out and we're going to go look at it in the lab. And biopsy is usually we want to see if it's has some kind of pathology. Okay. And then hysteroscopy, hysteroscopy. Hystero again means like saying hysterical and uterus. I don't know why we add those together. I don't know, because they used to think that women were hysterical. Don't get hysterical. And I don't know, that's just the way it was. It's weird, but I don't know. it's just a weird way. Let's see. Yeah, biopsy, that's good. Okay, building your word bank. Therapeutic suffixes. Okay, so more therapies in these. We're on 36 right now, and it's been 39 minutes. Ectomy means to take out. Plasty means to fix. Stomy means to put a hole in. Okay, and tomy is to cut, and tripsy is to break apart. Okay, so let's go these. Ectomy, gastrectomy. We're going to take out your stomach. You can have other ectomies as well, but gastrectomy is our good example there. Plasty, rhinoplasty. We talked about that one. Rhino means nose. Plasty means restructure the nose. You can have arthroplasty, which is restructure the joint. Osteoplasty, which would be to restructure or fix a bone. You can have many of those, okay? Stomy, colostomy. Colostomy. Colo means the colon. Okay, ileum is the lower part of the small intestine. So there's three parts of the small intestine. So we go from the esophagus, right? So you can have an esophagectomy. That's what it would be called. Have the esophagus removed. Gastrectomy, have the stomach removed. The first part is duodenum or duodenum. Duodenectomy. We could have the next part, the jejunum. We don't usually say that word because it's part of it's just a technical term. Jejunectomy. We have ileectomy. We could take out part of the ileum. We could have a colonectomy. Okay, we take out the colon. We could have a gastroplasty. Yes, you could have that. You could have ileoplasty. Yes, you could have that. You could have Yeah, any of those, coloplasty, whatever, colostomy, you can have ileostomy. Usually those people will have a colostomy bag. So it'll have a connector on the outside, usually on the left side, I believe. And they'll have a connector where there's a hole. That's the ostomy. And there'll be a two-way connector on there. And then they can hook another thing onto that so that any of the contents from their bowel can get out into that, because they don't have the rest of the stuff to get everything out. Okay, it's just not functioning for some reason. Sometimes it's post-surgical. Sometimes it's because of, say, cancerous issues and things like that. Osteotomy, that's to put a hole in a bone. And lithotripsy. Litho means stone. Lith, like monolith, means single stone that stands tall. A lithotripsy is actually when they get rid of like kidney stones. They put you in this like tub with a bunch of these sensors, these what do they call it? Ultrasound machine underneath it, and they use sound waves, bump, 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 and it breaks apart those stones inside you, called lithotripsy. Okay, building your woodbang instrument suffixes. Graph is one that measures, right? And meter is also one that determines the difference between sections of it, right? So a graph would be like, get it as time goes. A meter is give a one-time measurement, and a scope is to look. So electrocardiograph, electricity, right? We're using electricity in the cardio, ECG. Okay, we always say EKG, right? Oh, going to go to the EKG. Nobody knows what it means. Electro is still E, right? But this was a machine from like Germany, Austria. In those days, Germany was Austria-Hungary, okay, and Germany and those kind of areas. So it was a Germanic word for cardio, is with a K, cardio. So electrocardiogram or electrocardiograph. So ECG, it was a heart measurement. That's the PQRST waves. A thermometer, thermo means heat. So we measure your heat. And the weird part about the thermometer, when it first started out, it was basically measured on one guy. And they said his temperature is always around this level. That must be normal. Let's just make that the normal. And it just took from there. Ophthalmoscope is, ophtho means eye. We're looking for ophthalmo. We're going to look in the eye. Okay, look at the eyes. More instruments. Okay, osteotome. Okay, so osteotomy, to make a hole with an osteotome, is a kind of like, it looks like a apple core kind of thing. It just says a little, like, it's like a drill, right? As a tome makes a hole. A lithotripter, okay, lithotripsy means to break apart, right? So we use a lithotripter. It's funny because in the licensing as a chiropractor, in California, it specifically says we are not allowed to use a lithotripter. Why that machine? I don't know, but that's one that we're not supposed to use because it's a medical device. I don't know, whatever. Lithotrite, I would have to look that one. I can't remember off the top of my head. A lithotrite. Removal. It removes the stone. Okay. Specialties, ology or ology. This is page 39. No, what are we at here? Yeah, this is 39. Sorry. Huh. Yeah. Still says 39. Specialties and specialists. Neonatology. So a neonate is a brand new kid. Okay. Neonatology, psychology, osteology, neurology. These are the study of whatever the first part is, right? Ologist or logist is one who studies, is the person who studies. So a psychologist studies psychology. A neonatologist studies neonatology. Make sense? A dentist does not, well, see, it's funny, we don't have dentology. It's an interesting word, right? One who studies the teeth. We have a dentist. We have ophthalmologist, right? We don't have ophthalmology. We do have ophthalmology. We have optometry, autry, that's a measurement of the eyes. Very weird words. Some of them became common use and some of them didn't. They're still valid words. They're just, you'll get some weird looks. Polysomnographer. Ooh, polysom. Okay, poly means many. Somnographer is usually someone who measures sleep. I'd have to look at that one. That's a weird word. Specialties, psychiatry, psycho, crazy. No, psycho has to do with the mind, right? So someone who studies, you could say psychology or psychiatry. Generally, psychology works with one-on-one discussion therapies and stuff like that. And a psychiatrist can do the same, but usually those are medical doctors who also prescribe medicines for psychiatric conditions. Okay, like neurology or not neurology, the neurosis or psychosis. Osis is a condition of, right? We can't have neuritis, but we can't have psychitis. Yeah, you can't have that. What do you have? Like your mind is inflamed? That doesn't make sense. But the nerves can be inflamed. That's neuritis. Pediatrics, that's the only place we see it. Pedia means kid, right? So Pedialyte, right? So pedia as opposed to podia. Podia means foot. Okay, podiatrist is a foot doctor. A pediatrician or pediatrist would be a kid doctor, not a doctor who's a kid. It's a doctor who watches kids and looks at kids. It's not like Doogie Howser, which they have a new one, which is dumb. Because in most states that I know of, you have to be 21 years old to hold a degree in medicine, and you can't work under someone unless you're 21. You can't even be an EMT unless you're 21 these days. So I don't know how that works. Whatever. I'm around like a little working little marionette with you. Prefixes modify a medical term indicating something, either the absence of something, the location of something, the number or quantity, and the state of. These are good. So these are prefixes, the first part of the word. Absence of, location, number, quantity, and state. Attached directly being the word and one meaning. Okay. Okay. Oh, apneic. So a, without. Okay. Someone with apneic, they're not breathing. Okay. Anophthalmia, they don't have an eye, or they don't have sight. Antiversion would be like upside down, antiverted. Okay. Antibacterial, well, against bacterias, right? Antibacterial. Antiviral, antifungal. Okay, that makes sense. Prefixes: dystrophy, endoscopy, epigastric. Epi means on top. Okay. Sub would be underneath. Hyper is also above, because epi, like we think of like EpiPen, but that's not the same. So epinephrine, it's an epinephrine pen, but we used to they shorten the word to be epi, but epigastric is above the stomach area. Okay, dis is difficult. Okay, dystrophy. Trophy means to develop. So muscular dystrophy. The muscles did not develop. They were at a difficult development. Trying to think of other dis words: dystrophy, dystropic, disestablishment, whatever. I don't know. Prefixes: hyper and hypo. Hyper above or more. So hypercapnia. Capnia means carbon dioxide. So we have too much carbon dioxide. Hypothalamic, which means hypothalamus is below the thalamus, a part of the brain. Hypodermic, underneath the dermis, right? Hyperdermis, we don't really say, we say epidermis. On those ones, it's a little bit different. So there's some weird, like, they're rules, but not rules. They're kind of hard to get a hold of sometimes. That can be challenging, but as you use them, they get easier to use. Okay, so prefixes: inter and intra. So intra means in, and inter means between. Okay, so like intrastate and interstate, between the states. Intervertebral, in this case, between the vertebra, which are the bones of the back. Okay, and intradermal is inside the dermis. It's weird that Hawaii has an interstate, but they're not connected to any state. So where do you go? You just drive off in the water and end up in Alaska or something? I don't know. Prefixes, other ones too. Para, these are the P ones: per and peri and pre. Prenatal, before you're born, right? Presumptuous, pregnostic, I don't know, something like that. Or peri means around, P-E-R-I, peri, around. Perimeter, easy one there. Pericardium is a good one. Percutaneous has to do with, okay, percutaneous, on with the skin, actually, is cutaneous. And paraphilia, I have to look that one up. I don't even. Para usually is kind of like a roundabout, like peri means actually around it. So pericarditis, peritoneum, around the guts, pericardium, etc. Okay, so those, but para, like paraprofessional. You're not quite, but you're there. Okay, paraphilia, is that like you don't quite love them, but you like them? I don't know. I have to look that one up. You can look that one up. Okay. Prefixes poly. Poly means many. Polyneuritis, more than one nerve, inflamed, right? So neuritis, itis, inflammation of. Poly, many nerves inflamed, inflammation of the nerves. Okay. You have mononeuritis, of course. Post-ictal. Okay, so ictal has to do with passing out. Usually has to do with the seizure. So you have ictal and post-ictal. Post-ictal means afterwards. Okay, postpartum, after you had a kid. Okay, subhepatic, HEPA. Whenever you see HEPA, I know I'm throwing a lot of words at you guys, my God, but HEPA means liver. Okay, HEPA filter. The liver's a filter. There you go. Subhepatic, underneath. Okay. Oh my God, look at single and plural endings. Here we are on 49. We're almost done with this one. Then I'm going to close it off and we're going to do a whole different one, okay? So actually pretty good timing too. Singular, plural endings, vertebra, the plural is vertebrae. Arthrosis, arthroses, good. Appendix, appendices. That's a weird one. You don't really have any other appendices. 3 people would have appendices. That doesn't make any sense because in the body you have an appendix. Appendix also means something that's added onto the end of a document. Okay, right? There's the appendices. You read the appendices and get more information. Different animal. Okay, different part. Arthritis, arthritides. He has multiple arthritides. Okay, we study the arthritides. There we go. We don't study the arthritises, the arthritides. Phalanx, phalanges. Okay, phalange. Pokey things mean like phallus. Okay, like penis is phallus, right? So it's a pokey thing, right? And actually phalanx is the structure that the Roman soldiers would use that was like a pointy structure that they would break into enemy lines with. So, and also the phalanx is like a stick. Anything pokey, really, a phalanx. Phalanges, okay? You have 5 phalanges, and there are phalangeal bones, okay? There are 3, 6, 9, 12, 13, 14, okay? Digitus and digiti. You almost never use that word, digitus. Whoever uses the digitus, digits, okay? You say digits or digiti. You can use those. Therapy and therapies. We're going to do one therapy on you today, and we're going to use heat. We're going to do many therapies on you today. We're going to use heat and some massage therapy or something like that. Unusual letter, euthyroid, phalanx. PN is a hard one because it's n, okay? Oh, worst one ever is PS, psychology. There's a muscle called the psoas muscle. It's kind of a secret muscle because no one knows how to spell it. And also ptosis. Ptosis means to droop, right? And PT, ptosis. See, we don't really say the P. You don't say ptosis. You don't say psychology. You don't say pneumonitis. You don't say phalanx. I had a big problem when I was like in 3rd grade. I think it was, we learned the PH word, and I missed that day in class. And people were like, we're doing our new reading and you don't know how to say this word, phone. I'm like, yeah, I do. It's pahone. And I had a big argument and I was wrong. So maybe that's what started me interested in vocabulary. RH, okay, rhinitis, right, which means rhino, right? It's nose. Itis means inflammation. Usually rhinitis, what we mean is inflammation in the nose, and it's like runny nose is rhinitis, okay? X is Z, okay, like xeroderma, okay, categories of anatomy and physiology, pathology, diseases, or categories of terms. This is good. So some terms are anatomical, some are physiological, which means how it works. Anatomy is where it is and where it's located, what's next to, kind of thing. And then physiology describes how it works, and then pathology means how it doesn't stops working. It's a disease problem. Dis-ease. It don't work no more. Right? It's not running at ease. Diagnostic procedures or testing. Okay, those are the theory, ophthalmology, ophthalmoscope, those kind of things. Therapeutic interventions, which are treatments. So there we go. That is chapter 1, and kind of like oversees the entire thing, guys. So this is good. Don't forget, if you're watching this on YouTube, go ahead and subscribe so you can get the next one. I will mark this as week 1 terminology, the lecture portion, and we'll go from there. Follow it along. I mean, you should have been doing that already, but anyway, you can just sit and listen to this and listen to me ramble on while you're sleeping or in the bath or driving. I don't know, whatever. Anyway, you guys be careful, be good, and be happy. And you guys are killing the class, and that's your thinking, right? So you're doing it, you're learning your words and expanding your minds and expanding your brains and building all this new vocabulary in a whole new language. So it'll be fun and it'll be cool and groovy and all that kind of stuff. So let's end this now, and I'll talk to you guys next time. Anatomy and physiology terminology courses. This is Dr. Sean. Take care. Bye.